to dry dressing sterile. Okay, in the hospitals, you're going to find that some will require sterile, some will require clean, depending on what type of wound it is. Some of the hospitals, especially Mercy, they have their physical therapy aides do some of the dressings along with the wound care nurse, and depending on if it's a bed sore, decubitus ulcer, or whatever it might be, it might just be a clean dressing. But what you're going to learn today is you're going to learn it sterile. Okay. So the first thing you need to do with any procedure like this, you need to look at the doctor's orders, because the doctor's orders will tell you exactly what you need to do and how to follow it. So we're going to check the doctor's order. We're going to gather the supplies. The supplies you're going to gather, of course, some sterile gloves, whatever size you wear, a tub of gauze, because there's going to have to be dry gauze and wet gauze, an extra gauze just because we're going to irrigate this wound. Okay. These are called ABD pads, so it's an abdominal pad that you'll put on the top. Normal saline, a packing, because we're going to pack this. Okay, so packing strips, some cotton tip applicators, some measuring devices, whether it be the clear measuring device or a disposable measuring tape, some tape, and for today what we're going to use is we're going to use the saline that is in this syringe right here. Okay, this syringe itself is not sterile, so we'll irrigate it before we open up our sterile field. The first thing we're going to do is we're going to put on our clean gloves. Okay. First of all, actually, what we're going to do is once we check the orders, we're going to gather our supplies. We're going to go into the patient's room. We're going to gel in. Okay. And we're going to walk to the patient. We're going to ID the patient with 2 identifiers, patient's name and date of birth. We're going to explain the procedure to the patient. We're going to provide for privacy. Make sure when you're doing any procedure on a patient, especially if they're lying down, that you raise the bed to your comfortable position, because after a while, if you're leaning over the patient too long, then your back's going to start hurting. Okay, so we're going to put on our clean gloves, and we're going to lift the tape. It's easier if you can get one side lifted and just kind of go around. Okay. And once you get all the tape lifted, you want to grab in the center and grab as much dressing as you can out of here. You can't touch the wound bed itself with your clean gloves, so you just want to grab as much as you can without touching that wound. What I didn't gather is I didn't gather a garbage can, so you would put it in a garbage bag. If this is 100% saturated, then most facilities want you to put it in a biohazard bag. Okay. Other than that, it could probably go in the regular garbage, but once again, you have to look at the hospital policy. Okay. Before we do that, we're going to look at the dressing. We're going to look and see, how many pieces of dressings here, how much drainage is on each of them, and it's a percentage. Is it 10% saturated? Is it 50% saturated? On down to the outer one, which is the abdominal dressing or the ABD. Okay. This actually does have one more piece in it that looks like they have it under the underlining. Okay. And then you want to look and see this particular wound has a packing in it. So what I'm going to do is I'm going to say this has the garbage. So I'm going to lay the garbage right here. And then what I'm going to do is I'm going to grab a cotton tip applicator. That way I can pull that packing out of there as well. Okay. Well, once you get gloves on, these packages sometimes are a little bit more difficult to open. So we'll see if we can do it that way. Maybe or maybe not. Okay, I don't know.
Oh, and I think that our manufacturer we get them from too, they're not as nice.
I'll just do it this way.
Yeah.
Okay. So the packing is actually over here. So you're going to kind of grab it with both of them and kind of pull it out like this. Okay. And once again, this is the garbage. Okay. So once we've done that, you want to look at the wound. Okay. This particular wound bed, I'll kind of show it to you. That way you can see what I'm talking about. It has a lot of things going on in it. Okay. It has some new granulation, which is the reddened area. Okay. It has some infected areas, which are the yellowish looking areas, and then it has a piece of bone The one in the center is a piece of bone, so it's the coccyx that's there. In addition to that, what you can't really see, it has some undermining here, okay? And it also has a tunneling there that needs to be packed, okay? So all of this you need to notice, and that's part of your assessment, along with the outer area of the skin that's around the wound itself, okay? And this is all part of your documentation. Another thing that's part of your documentation is measuring, okay? So you're gonna measure this, and you can do it a couple ways. You can measure it with this clear. I really like these because it has a circle on it where it has the centimeters. It also has inches on one side and centimeters on the other. Most facilities measure in centimeters. So if you want to just measure this way, you can. So it's length width. So this is about 10 centimeters in length, and across it's about 7.5 across centimeters, okay? And then as far as the depth, you have to use the cotton tip applicators again, okay? So I'm touching the end of it, but the tips of them with the cotton tip is actually still sterile, okay? So basically what you're gonna do is go down to the center of it, and you're gonna put your fingers down to where the skin level is, and then you're gonna measure, okay? This is like 3 centimeters, okay? And then it's best if you use one for one area and then you use another Q-tip for another area as well, okay? So you're gonna go under the undermining, the same thing there, okay? And you're gonna measure it, which is about 1 centimeter. And then we're gonna get another cotton tip applicator, and we're gonna measure the tunneling. And the tunneling's on this side, so you're gonna push it in the tunneling, and you're gonna measure that as well, okay? Which is another 3 centimeters, okay? Once that's done, then you can dispose of these cotton tip applicators and also your measuring tool, okay? And so that's done. The next thing that we want to do, which I didn't grab, but I'll just tell you, it's probably good to get like a Chucks or a disposable pad that you can lay down on this side, or whatever side you're going to irrigate towards. It may be this side, okay? And so you're going to grab the irrigation, and then you're going to grab one of these gauzes. And basically the gauze is just going to gather or collect what you irrigate out of, okay? So as far as these syringes, they do have these at Mercy. You have to kind of pull down on them because they do have a little bit of an airlock in them. But just to show you, I'm going to turn it this way, but it's as far as irrigating, you grab this, you can put this down, maybe, at the bottom, and you're irrigating downward, okay? And basically, what you're doing is you're just getting what's there, and it's going to roll down into the gauze, okay? Whatever misses the gauze will hit the pad that you have, the disposable pad that you have there already, okay? You do not have to pat it dry, okay? You want to stay away from that as much as possible, okay? And then that irrigation's done. Okay, so this part's all done, so you're going to take off your clean gloves, okay? Put them in the garbage that you have here, and you're going to gel. Okay, once you've gelled, then you're ready for the sterile dressing itself, okay? So as far as setting up the sterile field, we're going to use the glove wrapper as the sterile field, okay? So that's the first thing that you want to, first of all, let's tear our tape, okay? The tape has to be, and we're guesstimating the length of it, but we're going to do a box tape, okay? So we need 4 pieces plus 1 additional for the date. So we're going to say, and I always put them where I could reach them on the table, so just tear 4 pieces. If you over tear, it's okay. If you under tear, it's a little bit more difficult. The small piece, date, time, initial, okay? And you're going to put that on last. So now we're going to go ahead and open our sterile gloves. I'm having trouble with these packages today. And we're going to open them up. There is an inch border on any sterile field that you have, so just know that the inch around everything is contaminated. So everything within that inch is okay. So that kind of gives way to your opening the package. And then the rest of these things you're just going to open and you're going to put onto the sterile field. Okay, so Make sure, another thing you can't do as far as maintaining sterile technique is you can't go over your sterile field. You can't drop your hands once you get the gloves on. You can't drop your hands below your waist. Okay, that anything out of your field of vision is considered contaminated. Okay, so the first thing we're going to open is, in order to do the packing, we have to have sterile suture removal kit. Okay, we need the scissors and the tweezers. Okay, so just kind of open them up, and you're going to drop them onto the sterile field. Be real careful because this is kind of tricky. Okay, so you're going to put it over and drop them. Okay, and then get rid of that package. The same with the abdominal pad. You're going to open it up, and you're going to bring it over it, and you're going to drop it, okay, and get rid of that. You're going to need some cotton tip applicators, and we'll see how well I can open these, because these need to be a little bit more, well, I'm not going to be able to do that. I don't know, these packages aren't the greatest for some reason. But you can't touch the ends of it, okay? So you're going to open it up, and you're going to drop them down onto the sterile field, okay? So if you open 3 packages, that should be good enough for this particular checkoff. Okay, and so this is pretty much the extent of what you need on this sterile field. You can move it back over as long as you are within that inch. You can't go over your sterile field once again. And so now we're going to open these other packages. So you're going to open the tub of gauze. Once again, you can go around it, you can't go over it. Pull it open up the saline. Always make sure that you look at the date, the expiration date, to make sure that it's still good, okay? Open it up. What some students will do is they'll leave the cap on, because once you get to a point that you're going to pour this, you're going to have one sterile glove and one non-sterile hand. For me, it's easier if I take the cap off. So however you want to do it, it's up to you, okay? As far as this, what we're going to do is we have to sterilize the lip of this container. So we're going to take that off. We're going to pour into a garbage, and this way that you pour is the side you pour on is the side that's sterile. Okay. So then once you do that, you're going to lay it down along with the lid, and then this is the packing. The same thing. You want to open it, okay, and leave it there for you to be able to use. Okay. And so now, at this point, I'm at least ready for one sterile glove, okay? So we're gonna pick up one glove, and as far as putting on sterile gloves, you can touch this glove as long as the inside of the glove. As you can see, this cuff is folded over, okay? So this part right here is the contaminated part. It's the part on the inside, okay? So if you pick it up, just kind of orient yourself to where the thumb part is. I myself put my dominant glove on first. It's just easier that way, and I'm a right-handed person, okay? So you put it on, make sure that you don't touch the finger part, okay, or it doesn't touch anything, your hand, or sometimes it's a little more difficult. I think I got the size a little bit too small, but it's okay. We can do that, maybe. Actually, it's good when you practice putting sterile gloves on to get one actually that's probably too small. Maybe I have this one wrong. Let me just look at this again. Okay. And to be honest, this is usually where students struggle too, is putting the gloves on. After the gloves are on, it's a little easier. So now this hand is sterile. Okay, so what we need to do is we need to grab some dry gauze out of here and put it on our sterile field. Okay, and now with this hand, we're actually going to pour the saline, okay? Remember, we can't go over our sterile field, but we can pour into here, okay? And so we're finished with that. Now, that's all we needed just one glove for. Now we can put the second glove on, okay? So as far as this glove, just make sure you can pick it out of your field, pick it up, just kind of orient yourself kind of where things are on it. It's hard. Sometimes these are real compacted together, and all the fingers all squished together. But when you put the second glove on, you need to put your hand in the cuff, under the cuff of it, and then you're gonna. I always tell students to hitchhike the finger with the thumb. That way, the thumb's out of the way. Okay? Because if you're going like this, the likelihood of you touching your thumb and contaminating that second glove or that first glove is high. So hitchhike your finger, put the glove on, okay? And then this is the second glove. Once you get them on, you're sterile both hands, okay? Then you can move things around on the center. You arrange things however you want, that it's gonna be easier for you to grab, okay? So now, what we're gonna do is we're gonna get a small piece of that packing right there, and put it into the saline, okay? So you're gonna grab, and then you're gonna cut, and you're gonna put it in here, okay? These are still sterile. You can put them back on your sterile field just in case you need them again, okay? So basically, you just kind of push it down. You can do it with that, or you can do it with your finger because everything's sterile here, okay? And so the first thing that we want to do is we want to actually put the packing in, okay? So just know that these tweezers that they put in these packs are the cheapest tweezers possible, okay? So when you go to hold this this piece of packing, you got to hold it very tight. If not, it's going to drop, and you're going to have to start all over with that part, okay? So I kind of hold it with my non-dominant hand and kind of push it in with a cotton tip applicator with my dominant hand, okay? So basically, you're going to put it down like this, and then just make sure that you don't touch the person's skin. Like for example, that touched the person's skin, okay? So what you can do is you can clip that part off into the garbage that we have here, okay? Put that back there, and then we can start, okay? And then just push it into the packing, or into the tunneling, okay? And once that's in there, you should have a little bit of a tail sticking out, because that allows the person that does the dressing the next time to be able to take it out, okay? And so we're done with this. And you can put it back on your sterile folder or not, however you want to do it, because they're still sterile once again. So the next thing we want to do is we want to get the wet dressing, squeeze it out, okay, because you don't want it dripping everywhere, and kind of open the gauze up a little bit because it gives it a little bit more surface area. And you can use these little cotton tip applicators, go straight down into the wound, okay? And then you're going to put it into the undermining. Okay? And get rid of this one. You want to get another one, squeeze it out. Open it up.
Wait a minute. Where did I go? There. Sorry.
It's okay.
Covered the camera.
And then these you can kind of go like this, just put them in, okay? That's actually kind of easier. This wound on this mannequin here is a very big wound. Some of them are smaller than others, okay? And this, I kind of picked a mannequin, unfortunately, that has a very big wound, so it's going to require a lot of gauze. We'll do one more. Once again, you need to make sure that you squeeze it out, that you're not dripping onto your sterile field, although this is still dripping a tad bit. And then put this one in. So basically, you just need to make sure that your whole wound bed is full. Put the dry gauze on, okay? And then the abdominal pad then on. Now we're completely done with the sterile procedure. You're going to grab the tape. And once again, this is a box. Tape all four corners. I actually didn't get enough tape, and we'll pull some in a second. Actually, we can do this. We can empathize a little. Okay, and then this is the one that's your initials, the date, and the time. Okay, and it goes on the patient's dressing. Once this is done, you make the patients comfortable, ask them if they need anything, clean up all your supplies, gel that out, and document.
Okay.